Emergency room visits are up for people experiencing mental health issues. Doctors say the rules in place to slow the spread of the coronavirus are actually increasing the cases of depression and even suicide.
NewsNation's Dina Baer explains how children are particularly at risk.
Of emergency department visits we're seeing for mental health conditions among youth has increased dramatically.
They can't play with friends. They're not in school. Sports are canceled. And for young ones, it feels like their life as they know it is lost.
We know that children are facing increased social isolation and losses of their usual sources of support, such as their peers, their teachers, or their coaches. And many children are no longer able to access their usual sources of mental health care.
At Lurie Children's Hospital, emergency room physicians are seeing a 50% increase in mental health visits.
Every day we see at least 10 children or youth, if not more.
So while children are not getting as sick as adults with SARS-CoV-2, the virus that causes COVID-19, there is another contagion that is threatening them.
Children and youth are very much impacted by what's going on in their family. We hear a lot about how COVID-19 is impacting adults more than youth. And that's true in terms of their physical health. More adults are being hospitalized or dying from the pandemic. But really among youth, it's a mental health crisis.
Whether it's the loss of a family member or loved ones with building anxiety and depression, the weight of the pandemic is falling on children hard.
Children with underlying depression and anxiety may experience worsening of their symptoms. And we are unfortunately also seeing increases in teens with suicidal thoughts.
Doctors urge parents to look for the signs.
You might notice subtle things such as that your child is having difficulty sleeping. You might notice that they're tearful or just more stressed compared to their usual stress level. In all of those cases, a good first step, if you're noticing any warning signs, is to talk to your pediatrician.
And take action when life is in danger.
Anytime that you're worried that your child might harm themselves or another person, is certainly an indication to come straight to the emergency room.
Most importantly, make the home a safe place to talk, to live, and to prevent loss of life. That means locking up firearms, medications, and liquor.
We do know that many suicides by teens are impulsive acts and often are not predictable. So keeping these unsafe items locked away safely is one of the best things you can do to prevent suicide.
Dina Baer, NewsNation, Chicago.
And as always, we do want to remind you there is always help available out there anytime. Simply call the number there on your screen, 1-800-273